When you have a tracheostomy tube, it is important to do daily care to prevent infection and to prevent your tracheostomy tube from becoming clogged with mucus. Caring for your tracheostomy tube may include things such as clearing your airways of mucus, cleaning the inner cannula, cleaning your tracheostomy site, suctioning, using a nebulizer, and keeping your tracheostomy site dry. Join me this week as I discuss how to care for your tracheostomy tube, and I will share some tips I have learned along the way. As we sleep, mucus settles in our airways. When we wake up in the morning and sit upright, the mucus in our airways shifts. One of the first things which should be done in the morning is check the airways for mucus. For me, I almost always have mucus in my airways in the mornings. My airways will feel heavy and congested. Many times, my breathing will sound different. There may be a rattling sound, or my breathing may sound louder or more labored. To get rid of the mucus, you can do two things. First, you can use your nebulizer. I usually run about 5 milliliters of normal saline through my nebulizer. This helps loosen up the mucus in my airways. For more information about using a nebulizer, please see the video. Have a nebulizer? Info you need to know. Once the mucus is loosened in the airways, next you will need to clear the airways. If you can cough, coughing is all that may be needed to get rid of the mucus. If you cannot cough, or if coughing does not get rid of the mucus, a suction machine is a device you can use to get rid of the mucus from the airways. For more details about suctioning, please see the video, How to Suction, info you need to know. Any mucus which is coughed up or which is suctioned up by the suction machine is called sputum. It is important to examine the sputum for any changes. Normal sputum should have a watery consistency and should be clear or white in color. If there are any changes in the color or consistency of the sputum, this may indicate an underlying health condition. To learn more about sputum and its importance, please see the video, In Sickness and in Health, Know Your Sputum. One item, which may be part of your tracheostomy tube, is called an inner cannula. This piece of plastic will fit inside your tracheostomy tube. Mucus will build up on the inside of the inner cannula. You'll want to take this out at least once a day to clean it. Ideally, you'll have several inner cannulas, so as soon as one gets dirty, you can simply take this out and replace it with a clean one. To change out the inner cannula, simply pop the inner cannula out of the tracheostomy tube. Next, find a clean glass container. Please use glass and not plastic. Now, put the inner cannula in the clean glass container and add distilled water and fragrance-free dish soap. Gently swirl around the inner cannula in the soapy water and let it sit in the soapy water for at least 15 to 20 minutes. Next, take out the inner cannula. Grab a clean glass container and add a mixture of 1 part hydrogen peroxide and 1 part distilled water. Place the inner cannula in the solution. Allow the inner cannula to soak for at least 1 hour, but preferably 24 hours. Next, remove the inner cannula and rinse it off in distilled water. If you're going to use the inner cannula right away, you may place it inside your tracheostomy tube. However, if you're not going to use it right away, find a clean paper towel and allow this to air dry on top of the paper towel. Please also remember, before touching the inner cannula, wash your hands. Also remember, anytime you're handling the inner cannula, please only touch this outside rim. Please do not touch any other part of the inner cannula to prevent infection. Once the airways are clear, the tracheostomy site should be examined and cleaned. However, before touching the tracheostomy site, please wash your hands with soap and water. Please do not use hand sanitizer unless it is absolutely necessary. We live in a society in which hand sanitizer is a popular alternative to hand washing. However, hand sanitizer does not kill many viruses and bacteria, such as Serratia and the flu viruses. Many hand sanitizers are also very poor at killing coronaviruses. With this said, many viruses and bacteria are left on the hands after using hand sanitizer. This may cause an increased risk of developing an infection when touching the tracheostomy site. Henceforth, please wash your hands thoroughly with soap and water before touching the tracheostomy site. Also, if you're providing care to a person with a tracheostomy tube, please wear gloves when touching the tracheostomy site. We all have bacteria on our hands, which is part of our normal skin makeup. Each person has a unique bacteria composition. Normal bacteria on your hands is not harmful to you. However, the bacteria on a caregiver's hands may cause infection and severe illness when touching another person's tracheostomy site. If you are providing care to a person with a tracheostomy tube, please wear gloves. After washing your hands and putting on gloves if you are a caregiver, carefully examine the tracheostomy site. Gently lift up on the tracheostomy tube and check for any wet redness, swelling, and drainage. Also check the top of the tracheostomy site by carefully pulling down on the tracheostomy tube. Next, clean the tracheostomy site. This can be used by using gauze and either using a tracheostomy cleaning solution or using mild soap and water. When cleaning the tracheostomy site, please do not use tissue such as Kleenex or toilet paper. Both these products fall apart when wet and also leave behind a fiber residue. Also, avoid strong soaps such as concentrated dish soap and antibacterial soaps. These soaps may cause the tracheostomy site to become dry, cause the skin to crack, and may cause the tracheostomy site to bleed. Wet the gauze with the cleaning solution or use water and a small amount of soap. Carefully clean around the tracheostomy site. Do not rub vigorously the gauze back and forth. This will cause irritation and may cause the tracheostomy site to bleed. Instead, use gentle pressure and wipe only a few times until the tracheostomy site is clean. If there is drainage around the tracheostomy site, which is dried onto the skin, leave the wet gauze on the area for a few minutes. Then, wipe the area clean. It is important to keep the tracheostomy site dry to prevent the tracheostomy tube from rubbing and creating granulation tissue. Drainage around the tracheostomy site will vary from person to person. Some people will have very little drainage, while others will have a lot of drainage. If you have little drainage, you may be able to keep the tracheostomy site dry by simply wiping the area every few hours with some gauze. If you have a lot of drainage, a split gauze may be needed. Simply open up the split gauze and place it around your tracheostomy tube. The gauze should stay around the tracheostomy tube by itself. The gauze should be changed at least twice a day, once in the morning and once at night. If the person has a lot of drainage, check the gauze every 4 to 6 hours and change as needed. A complication of having a tracheostomy tube is the development of granulation tissue. This tissue will have a reddish brown appearance and will look as though it is growing around the tracheostomy tube. Granulation tissue is the body's response to trying to heal the tracheostomy site. Granulation tissue is highly vascularized and will bleed easily. When changing out the tracheostomy tube, the granulation tissue may bleed. This is normal. My tracheostomy site frequently bleeds when I do a tracheostomy tube exchange. If you wish to see what happens to my granulation tissue during a tracheostomy tube exchange, please see the video, How to Do a Tracheostomy Tube Exchange at Home. Granulation tissue may range from only being a nuisance to being very painful. If the tissue is causing issues with doing a tracheostomy tube exchange or becomes very painful, consult with your primary care provider or pulmonologist. There are methods they can use to remove the granulation tissue. The tracheostomy tube should be kept secure around the neck. A trach tube holder or trach tube tie should fit snugly around the neck. When securing the tracheostomy tube, you should be able to fit 2 fingers underneath the tracheostomy tube holder. If the trach tube is too loose, the tracheostomy tube will rub the tracheostomy site. This will cause the body to produce granulation tissue. If the tracheostomy tube is too tight, pressure sores may develop at the tracheostomy tube site. Thank you so much for joining me. Please remember to like and subscribe down below. I hope you have a great day and a wonderful week. Bye-bye.